Okay, so tell me a little bit about yourself and how you got started in the community.
So my name is Sharon Baum, and I've been part of the community working with individuals with different types of disabilities for the last 13 years, actually. The path towards that was not conventional. I remember dreaming of being a journalist one day and writing and interning for that. But there was always something kind of calling out to me as I majored in psychology and I wanted to do something with psychology. I wanted to become a psychologist because I really wanted to understand people better and I really wanted to help people who were struggling. So there was always this voice in me that was kind of calling me internally to service and to help. And I think it took some time for me to come around to the specific area that I ended up getting involved in, which is speech and language pathology. I think it was my last semester of college, and I had gone to a hospital and I observed the speech therapist there. And I saw like so many layers of so many different ways that speech language pathologists were helping people, whether it was a traumatic brain injury or stroke, things that I didn't really know about much, things they don't really tell you or share with you. They kind of keep it like their little secret. So you have kind of a myopic view of what the field really is. And so that kind of launched my path to where I am today.
hmm I was looking at your LinkedIn profile, and you, aside from being a speech language pathologist, you also work in the education realm. So I was wondering if you could talk about those two things.
Absolutely. Yeah. Um, yeah, I mean, so in my mind, I thought I would end up in the medical field of speech. And then I graduated and for my master's, and I ended up taking a role in education. And in my second year in the New York City Department of Education, they had opened up something called the NEST program, which is geared towards individuals who are on the spectrum but who need social support so that they can access a social thinking curriculum, which is basically an ability to understand the social world around them. And that was the biggest blessing that could have happened to me because I had such a pivotal role in it. And I did that for about 9 years. And that was really the majority of my speech role with adolescents specifically. And in that, I learned so much about adolescents, about what their needs are, um, what are the things that make them tick, but really thinking about, how to utilize people's strengths and interests. Because I think a lot of times when we're trying to help people with different types of disabilities, um, and all of us have challenges, whether you're on the spectrum, not on the spectrum, whether you're labeled as handicapped or you're not. I mean, we all have different challenges. But at the end of the day, what I learned from working with that population is really the nuances of how to use strength and interest to really get people to internally be motivated, not externally, but internally be motivated to really develop in this, in that particular case, their social skills. Now, moving on to what I do now, which is kind of, well, very different. Now my main role is still in the New York City Department of Education, but the role that I have now is more of a macro, not a micro. So it's kind of not working individually and seeing the progress like I used to, like one on one with or in groups with adolescents, but it's kind of taken a step back and now trying to oversee a different age group, which are preschool children, and trying to help support their needs. And, the hard part about that is I don't get to meet with these preschool students, right? I get to read evaluation reports. I get to read through a lot of different reports that are being sent my way. And then based on that, I'm based on collaboration, obviously, with other people. I get to make decisions based on what they're going to need, whether it be speech and language therapy, whether it be occupational therapy, whether it be a more specialized program that would be best suited for them so that, they can get that jump start early on in life rather than waiting until, it's, they're a little bit older and it's a little bit harder to learn those skills. So it's been interesting kind of um almost separating myself from the in-person kind of thing and working with the families more. it's been a whole different kind of transition.
Yeah, I bet. My next question is, what sorts of things do you look for when looking at whether a patient, is like more independent and can really sort of thrive in whatever setting, the educational setting, what have you? Because what you're doing now kind of like helps individuals in that way. So I'm wondering what's your approach, I guess.
Oh, into thinking about if the individual can be independent more, right?
Exactly, yeah.
So I think that ultimately, I think that the main thing is uh you speak to parents, so parents will have their perspective on it. Then you speak to people who are representing, different agencies that evaluate these kids, and they'll have their perspective on it. And then you kind of collaborate and you work together and you have a meeting, right? And then you're still thinking about, like, what can they do on their own, right? Because a lot of the things that I've noticed that come my way, a lot of the reports tend to focus on not necessarily strengths, but kind of things that are challenging for the child, right? So then it kind of creates kind of a challenging pathway, because you're thinking about, hey, what are the things that the child can actually do, right? And what can they do on their own with less scaffolding, with less support? But because the goal is to see, what services can be provided, I think what gets lost sometimes is, hey, what can the child do and what can they do on their own? So I think the approach that I use when I'm in the meetings, and that's, I think, where I get the most information, is verbally, in the meetings, our teams, our faces are there usually. um it's trying to really say, but what can this individual do? What are they able to do? um yeah, you mentioned that they're having a difficulty, let's say, with communicating, and they're having difficulty producing words, but can they use gestures? I'm just giving you an example. And if they're
Hmm.
able to use gestures, right, how are they using those gestures? Are they using them in a functional way? um are they doing it on their own? And I think that when you formulate questions into kind of taking taking a step back into, okay, let's think about, maybe they're not at this level yet, but what level are they on? What can they do? And in many cases, they can do a lot of things independently, but they're either not doing it because someone's doing it for them, or because it's kind of been learned over the years, through earlier intervention, especially before preschool, because I'm dealing with the preschool age, that these are the things that we're trying to look for, like supports that help them.
Hmm. Yeah. And I also think I was discussing, earlier with some people with some people, like I remember I talked to one lady, she's a parent of a special needs student, who's all grown up, and she would talk to me about like how we had sort of this discussion around how in IEP meetings, the team members, whenever they're trying to implement, oh, what's best for my child or for my kid, it's, those implicit biases, you know what I mean? We all
Mhm.
have implicit biases, so I think that plays a role into that as well.
Yeah, I think that we all have that implicit bias. And I think that, especially when you're not meeting the child, right, it even lends itself more to the implicit bias, because sometimes you'll read a report and it looks like the profile of something that you've seen before, right? And I feel like it's almost memory bias, or episodic memory bias, where you've seen this thing before and you're like, wait, that must be it again. And it kind of uh separates the person from being an individual and kind of grouping them into a profile.
Yeah, exactly. If I could move on, like what are some of the key stakeholders that you work in your sort of in your line of work, I guess?
Sure. So currently, it's just countless amount of people, because it's New York City and it's a bureaucracy, and there's so many people that have their hands in the pot. I have my boss, who's the chairperson. I have my colleagues who are other administrators. But when I'm working with trying to make these decisions for children, right, I'm working with the evaluators who evaluated the child. I'm working with the families, I mean, to figure out what's going on. I'm working with schools, obviously. So, principals get very involved. And that's where also some things can get a bit tricky because sometimes people in the school, whether it be the teacher or the special education itinerant teacher, which is a SEID, which is what we have as a one-to-one support for children who have difficulty accessing the curriculum without having like somebody help them a little bit more. Sometimes without going on a tangent, they can have their own kind of needs in the school, for the child and maybe not the appropriate supports. And so then they come in there. So, and then in addition to that, you're also dealing with obviously supervisors of different people, supervisors of speech therapists, supervisors of occupational therapists, supervisors of, physical therapists. And then also the actual people themselves that work with the individual, the what I am and what I was more actively before this role, but the speech therapist, the occupational therapist, the physical therapist, the nurses, the medical team, because again, there sometimes is a medical team involved too, even though we separate that because unfortunately, the departments, which I think is something that in the future needs to be worked on, but how to merge the two because medical, I do believe, needs to be somehow merged with educational, even though they're two separate areas.
Mm-hmm. I guess my last question is, how can your work in the education realm and as an SLP, speech language pathologist, make a difference in people's, lives, but also act as a way to as a catalyst for change? Because there are certain things that need to be done to make people with disabilities lives better.
Yeah, I mean, I think one of the biggest things is, and it's going to sound cliche, but it's really educating others. And when I say educating others, it starts at home. So, for example, even in my own field, I feel like there are certain areas that if you weren't trained appropriately, right, or you weren't trained at all, you may not be looking for those things when you're looking at someone. And so you may not be getting a holistic view of it. And recently, this was something I even brought up to my boss, where I said, "Oh, I get so many evaluations, and people are asking me questions about them because they know I'm a speech therapist." And that specific piece is that social pragmatic piece, which is social communication and accessing the social world. And people sometimes overlook that and choke that up to, oh, the person's just kind of, doesn't know how to play in the sandbox kind of thing. And that puts a negative spin on the individual. It's kind of showing that, hey, what, they don't know how to do something, they have a behavioral problem. And so I think that it's important to really have the professionals educated because again, all the professionals that work on different things, right? So, when you have a whole team of people working on with different individuals, one is coming with a different level of expertise. And unfortunately, not all have the same expertise. So I think that, and your question was, how to make the lives better. I think that it's constantly somehow figuring out a way so that all the things that are affecting people with disabilities are being constantly brought up in a way to individuals so they can maintain their quote unquote best practices so that they can know what they're looking for, as opposed to just saying, hey, what I find a lot is, the emotional regulation, behavioral, but where is that coming from, right? Like, what are you supposed to be looking for? But also I think acceptance, I mean, that's a big thing too, is, I find that, the best place where you see this happening is in an integrated class where you have, children who are, have a labeled disability and children who don't, and they have to work together collaboratively. But, through that, everyone's taught a level of acceptance and tolerance and people actually start learning, oh, wait, the person with the disability actually has like a really cool strength. Like they're really good at, let's say, I'm just giving you an example, like they're really good at chess or they're really good at this or they're relying on something else, right? Which gives them a super strength or a superpower. And so I think that knowing that, hey, how can we learn from each other? How can we use each other's superpowers to benefit each other? I mean, obviously it's a long, term thing. And, the two things I've stated, one is, developing people through ongoing professional development so that they can really know, what they're looking for instead of just brushing something off as something that might not be the case. And also, obviously, the tolerance and acceptance piece by really acknowledging and looking for the superpower piece. But I think that we're actually evolving, and I think that it is coming to people's minds more because the whole neurodiverse movement, for example, I think
Hmm.
brought to people's minds, the idea that, hey, someone could be neurodiverse, but they're like actually like the best engineer I've ever met. Um, in fact, I have a past student who I think is going to be like one of the world's top engineers, and it's going to make me look really silly. But the point is, it's all about, I think we're on the right path, but I think we do have some ways to go.
Yeah, and it's also that that individuals, have that gift, and it's important to share that to the world.
Yeah. And again, I do like also like really believe that sharing that gift is important, but the only way that people can share the gift is if they're given the tools and strategies to share the gift. Because if someone's just going to be told, oh, you have this and you have this and you have this and you have to work on this, they're not going to be as willing to do that. But if they're
Hmm.
taught from a young age that, hey, you know what, you have this challenge, but that challenge actually gives you a superpower because now you're using a different, you know, thing. And I see it all the time where a lot of students I've worked with, have relied more on visual, let's say. And all of a sudden they're like so good at this, all these visual things that I can barely like, I'm not so good at the visual integration piece. And they're just like really thriving at it, and they're really better than their counterparts at looking at things in a very visual way, and they're super artistic. And yeah, I mean, I just think that it's important to kind of lay that foundation from the parents at a young age, but also from the people that obviously work with anybody who is labeled as having some sort of disability.